welcome back to my channel, and if you're new here, welcome for the first time. I'm Christine, and today I'll be discussing recovery from an athletic injury. Injuries are something we hope to never endure, but it sometimes happens to the best of us. Whether it's rolling an ankle or a gradual overuse injury, chances are you'll experience an athletic injury sometime in your life. Today, I'm going to talk about a common athletic injury, a grade 1 ankle sprain, where the ligament has been overstretched but not torn. What we do in the first few days after an injury is critical. If it isn't dealt with correctly, it can either lead to a more serious injury or something that can have a spider web effect in the body and be more of a chronic issue down the line. Thankfully, with the proper techniques, you can heal from a sprain rather quickly. We all have heard of RICE: rest, ice, compression, and elevation. It was the go-to approach for decades, but now as more research has come in, we're changing our approach a little. Modern research and studies have shown MEAT is the way to go. M-E-A-T. M stands for movement or micro-movement, E stands for exercise, A stands for analgesic, and T stands for tape. This method is much more effective for dealing with something like a sprained ankle. The key difference between RICE and MEAT is it's a passive recovery versus an active one. While RICE focuses on resting and remaining static, MEAT focuses on doing what the body is designed to do, moving. MEAT places an importance on maintaining the range of motion, strength, while it helps you recover faster. There are certain injuries where remaining static is the way to go, but an ankle sprain isn't one of them. So I'm here to show you my bulletproof ankle rehab program using the MEAT method. So let's get moving. If you like these videos, make sure that you subscribe to my channel and turn on the post notification bell so you don't miss another video. And remember to always consult your doctor before starting certain treatments. Most sprains occur on the anterior talofibular ligament. This ligament connects the talus bone to the fibula and is the weakest of the lateral-collateral complex of the ankle. When we sprain our ankle, an enormous amount of strain is placed on this ligament. This strain can weaken the ligament and lead to re-injury down the road. We need to work to reduce this strain while allowing for some level of movement in the ankle. My ankle rehab protocol actually starts at the end with the T in the MEAT method and works its way back to M. This order works best when addressing an ankle injury. Within the first 24 hours, we want to support the anterior talofibular ligament with taping to relieve some of the stress bound up inside it. Taping, when done correctly by a professional, is akin to giving yourself a localized exoskeleton that allows for micro-movements. Micro-movements are gentle, small ranges of motion you do for short periods of time. If you're in pain or moving through a larger range of motion causes pain, then doing micro-movements can help release stiffness and retrain your motor control in a non-painful way. Think of motor control as like an autopilot on how you move. There are also some taping techniques that can be done at home. Although they won't be as effective as taping done by a professional, they can still aid in your recovery. Analgesics are helpful to manage pain. While ice itself is not an analgesic, it does have analgesic effects and dulls pain by decreasing inflammation and slowing down pain signals to the brain. Studies have shown that if you do use ice for swelling, it should only be used for 24 to 48 hours following the injury. I prefer using a topical salve for reducing pain. A guideline published in the Annals of Internal Medicine in 2020 recommends using a topical non-steroidal anti-inflammatory drug. I've used Ambray Garden's Deep Rub or Muscle Recovery on myself and my clients, and it works fantastic. Technically, it's not an analgesic, but I found it works great. At last, we have the E for exercise. We'll start the exercises with M, micro movements, and work up to larger movements progressively. To start, we want to exercise with no added load. That way, you can move your muscles and tendons with minimal stress. If you've ever been to a physical therapist for an ankle injury, you might have heard of your ABCs, basically writing out the alphabet with your feet. These are perfect exercises for rehabbing an ankle. For this exercise, you can either sit or lay down, however you feel most comfortable. Pull your thigh in your chest and start drawing controlled circles or doing ABCs with your ankle. You can begin with smaller micro movements if you have pain with the larger movements. Watch for any movement that is coming from the tibial tuberosity, which is the front part of your shin, when doing your circles or ABCs with your ankle. If your tibial tuberosity moves, you can use the other hand for extra reinforcement. Now onto the loaded exercises. All but one of these exercises will be performed on both the non-injured and the injured ankle. Studies have shown that training the healthy side can even aid in the recovery of the injured side. Isometric exercises strengthen your muscle and increase the range of motion without overstressing the joint. For this reason, this next exercise is great for rehabbing an ankle sprain. Start this exercise by sitting in a chair or laying on your back on the floor with your legs out in front of you. Cross one leg over the other at the ankle. Start with the injured ankle on the bottom. Push the top of your lower foot into the sole of your other foot. Take care not to flex your ankle as you do this. Press your feet together for 5 seconds and then slowly release. Repeat between 10 to 15 times. Cross your ankle in the opposite direction and do the other leg. You can vary the position of your ankle to strengthen your tibialis anterior in other ranges of motion. You can also use a band instead of your foot to create tension. A sprained ankle can affect your balance even after you've recovered. So it's important to work some balance exercises so your ankle's ability to stabilize your body isn't lost. Have a stable object like a chair or a kitchen counter nearby so you can grab onto it for balance if necessary. Lift the non-injured foot off the ground and make sure that your legs do not touch each other. Hold for 60 seconds. If you're able to hold this position easily for more than 60 seconds, you can do the exercise with your arms crossed or your eyes closed to make it more challenging and unstable. Switch to the other leg. Injuries don't just happen in one plane of motion. Therefore, our rehab has to be in more than one plane. This first one is in the transverse plane. Stand upright with your feet shoulder width distance apart. Have a stable object like a chair or a kitchen counter nearby so you can grab onto it for balance if necessary. Lift your non-injured ankle off the ground. Rotate your torso above the waist and away from the leg of the injured ankle. Repeat 5 to 10 times and switch onto the other leg. Stand upright with your feet shoulder width distance apart. Have a stable object like a chair or a kitchen counter nearby so you can grab onto it for balance if necessary. Lift the non-injured foot off the ground. Push your lifted leg straight back behind you as you lean your body forward. Stand up straight and repeat 10 times. Switch onto the other leg. Stand upright with your feet shoulder-width distance apart. Have a stable object like a chair or a kitchen counter nearby so you can grab onto it for balance if necessary. Lift the non-injured foot off the ground. Push your lifted leg straight away from you. Think of making an upside-down Y shape with your body as you lean your body forward. Stand up straight and repeat 10 times. Switch onto the other leg. This is the only exercise we'll be using only one leg. Start with your feet hips width distance apart. Take a wide step out with the injured ankle. Bend your knee on the injured ankle as you push your hips back. Keep both feet flat on the floor throughout the lunge. Push off with the injured ankle and return to standing. Repeat 10 times. This last movement should be done after swelling has been reduced and there's no pain when walking. Start with your feet hips width distance apart. Lift your foot of the healthy ankle off the ground. Now hop immediately. Switch onto the other leg. To promote stability, we need a good balance between mobility and strength. So now it's time to stretch. Secure a band around a pole and step into it so the band is in the crease of the ankle. Facing away from the pole, take a half a step forward or until you feel tension around the ankle. Keep your weight evenly distributed on both feet and slowly bend your knees and sink down towards the ground. Make sure that you keep your heels on the ground and your knees are not caving in. Continue to sink down slowly with your hips to deepen the stretch. Hold this stretch for about 30 seconds and change sides. Place this ball of your foot on a small 5-pound plate or books with your heel touching the ground. Bend your knees forward and hold for about 5 seconds. Release and repeat the movement about 30 times. Switch onto the other leg. Stand up straight and squat down until you cannot go any lower. Make sure you keep a straight spine and place both arms in the inside of your legs. If you don't have the range of motion of your ankles just yet, you can elevate your heels slightly or widen your stance. Hold the position for about 30 seconds. Stand up and repeat 3 times. When recovering from an injury, it's important to choose the right exercises and methods. Hopefully you have a good idea now how to treat a grade 1 ankle sprain. If you have an injury you'd like me to cover next, put it in the comments below. You can also try our OCAM Edge program. It's a multifaceted, targeted training program to help you improve athletic performance, reduce pain, challenge yourself, and avoid injury. No secrets, no BS, just science-driven training. Thanks for watching, and I'll see you next time.